Good afternoon. Welcome to United TV and welcome to Bariatric Friday. Today we are going to discuss another topic with bariatric surgery journey, and we are here to talk about facts, not fads. And our goal is to tackle the issues which are important for those who are going through this bariatric surgery journey. And one of the overlooked issues is maintaining your results after bariatric surgery. Of course, I'm going to have our expert, Dr. Isaias Irgau, with me to help me to better understand what can be done in order to keep the weight loss and maintain that. And Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's great to be back for yet another wonderful session of Bariatric Friday.
Well, thank you. And I know almost every Friday you are here and you make the adjustments on your office schedule. And because we know that this is important for our patients.
Absolutely.
So, and because of that, we want to make sure that we better understand. And then that's one of the reasons that we repeat these is because it's not simple, yet it looks simple. But then when you go into the details of different issues and different things impacting each other, many people sometimes don't understand how complex these can be. That's why I trust our experts in this, and especially when it's about clinical, I let you guys to lead us. Now, usually first year, almost 12 to 18 months, where we see the most weight loss right after surgery. Now, one of the issues that we also know is this is kind of called the honeymoon. Now, I'm assuming that everyone has really good experience in their honeymoon, so that's why this is called honeymoon. So because you see the most impact. Now, things change, can change, not for everyone, but it can change. Because what we need to remember is bariatric surgery is a tool. It's not a magic, and it's not curing the problem, but it's helping the problem to be controlled and better deal with the issue. Now, what's the percentage? How often do you see patients gaining weight after these 12-18 month period?
So it is important to define what we mean by weight gain, of course, Kemal. Generally, some fluctuation of the weight upwards, whether it is 10, 15 pounds in the long term of anybody who has lost, 100 pounds or more, that's not uncommon. We see that fluctuation. And because of that, I very often discuss with patients about what their goal is and where they should aim to be in terms of the weight. As you know, the desired weight is a range, it's not a specific number. And that range could be different for different individuals. From our point of view, we want them to lose enough weight so that they will be healthy, right? But that does not mean they have to be to an absolutely normal body mass index. Some people may not be comfortable at that. Some people may want to stay at a slightly higher weight because they like looking at themselves at that weight. And that's okay as long as it's not an unhealthy type of weight, right? So, for instance, today I was discussing with a patient about the fact that they need to lose at least 80 to 90 pounds for them to be within a healthy range. Of course, if they wanted to reach their ideal weight and be at a normal body mass index, maybe they would need to lose 110 pounds or so, okay? Well, from this patient's perspective, they communicated that they've never been at that weight throughout their life, and they would not be comfortable being at that lower weight. So they would like to lose 80 pounds, and that would be a good range for them. And what I say to them is, look, you would like to be 80 pounds lighter than when you are at the point that you feel is a comfortable weight for you. In that case, you should aim to lose 90 pounds because you will have that little cushion because there may be some weight rebound. So some weight regain and some fluctuation is not uncommon. When we talk about weight regain, we talk about serious weight regain. That actually doesn't occur very commonly. It typically occurs in about 10 to 15% of our patients. And what type of weight regain are we talking about? We're talking about people who end up regaining so much weight that now they will have lost overall less than 50% of their excess weight. And to just give you an example in numbers, let's say, let's look at what we define success as bariatric surgeons, right? We define success generally when people lose 50% of their excess weight and they maintain that in the long term, 5 years, 10 years, 15 years, okay? So, for instance, if a person's ideal body weight is 150 pounds and they come to us at 250 pounds, right? Well, let's say they lose weight, they lose 70 pounds, but then they maintain 50 pounds weight loss. If they maintain that, they are still a success for us. Now,
so they go down to 180, but now they're at 200.
They're 200, that's right. But then if in the long term they end up gaining so much weight that now they're getting close to their original weight, they're less than 50% away from their original weight, then we worry. That is a significant weight gain. So to answer your question, essentially, significant weight regain can be seen in up to 15% of our patients in the long term.
So, in the beginning when I said complex, that complexity, one of the elements of that complexity is our body itself. Well, it's supposed to be, it has its own mind and it does certain things on its own. And we sometimes fight those habits or those maybe structural setups that we have. Now, if you can explain how our body psychologically tries to regain weight, why is that happening?
Absolutely. So when we look at the overall pathophysiology of obesity, really it's a combination of biologically primed situations and then the environment. That's what brings about the disease of obesity. Okay? When we do surgery, bariatric surgery, we are definitely influencing many aspects of that biology, but we're not eradicating that biology. In other words, the propensity for somebody to be at a higher weight as determined by their own genetic makeup, we cannot change that with the surgery. What we can change is the mechanisms by which this is executed in the body physiologically. That also has limitations. In other words, if a person has a tendency to be at a higher weight, surgery will interfere with that, but it will not take that tendency away, right? Which means that, let's say somebody has struggled all their life with weight, right? They've done different diets, it never worked. They do bariatric surgery, they succeed, right? Because bariatric surgery is powerful. But with that success, it is important that that person also implements changes in their lifestyle that do not give any room for the body to want to go up at higher weight, right? If they do, then that weight will come back. For instance, we will talk about, what kind of situations bring about that weight regain. So going back to maladaptive eating, for instance, okay, one of the maladaptive eating, going back to that, like for instance, a classic example is grazing. Grazing is a situation where you have somebody who's not necessarily eating a lot of food at one time, but they are constantly grazing on something, right? So a typical example would be somebody who has a sedentary job, desk job in front of their computer, and they would have a jar of M&M in front of them, right? If they are constantly snacking on that type of grazing can, in the long run, lead to weight regain because it's a little bit of excess calories every day repeated over and over again, right? And that's associated with that person also sitting on a chair all day long and not exercising. Yes, that person will come to us at a very heavy weight. We will do bariatric surgery, and they will have that honeymoon period of a year or two in which they will have lost a lot of weight. But if they go back to that lifestyle, which means sitting most of the day and not doing any exercise afterwards, snacking continuously on things that are not going to be affecting that little stomach, because you can fit M&M even in the smallest stomach, right, without feeling full.
Right.
If they do that, then obviously that tendency of the body to regain weight will reappear, and it will happen. Now, one of the reasons we focus extensively on preparing patients before surgery to adapt a good lifestyle, including repeated encounters with nutrition, including psychological counseling, and also asking them to attend sessions like Bariatric Friday, is because this message needs to be on constantly, right? They cannot let go of their guard. It's very important for them to understand. In other words, we are dealing with a disease that is chronic. It's not eradicated. It's controlled with bariatric surgery, right? And that is the message that we have to give to our patients as well.
So, one thing that I promise I won't mention any names. What you are describing, glazing, right?
Grazing, yeah, grazing like
Grazing, so
grazing like the sheep or the cows in the grass, like they are grazing all the time, right?
Okay.
So that's where the word comes from.
So one is
essentially.
because they're not doing much. So in the example of sheep, so they're probably just in one area.
One area, yeah.
So then the other thing is it's right there.
Yeah.
So there was a situation in the office which I took care of, but because this whole issue of food pleasing, pleasing others with food, I see, and they probably didn't. Maybe this is my way of just explaining my logic. So here we are promoting healthy lifestyle. Okay. There may be time to time. We are not going to follow everything. I'm not going to, even pretend like I would be the best, on eating habits. But promoting is where the problem is. Promoting is if I have one, McDonald's day, if I'm posting that and then just telling how much pressure I'm having from that would be the promotion part of it, right? So they have so much junk food on one of the tables here. So again, I will say, so Susan doesn't have to get nervous. I won't name anyone. But the issue was, to me, every time I passed that desk, I was just fighting. I'm like, maybe I should get something, or maybe I should, take something. Because it's all junk food. So then I said, you know what? If I'm going through this, maybe someone else is going through and I'm not able to voice out their opinion. Yeah. And I'm like, why are we allowing this? We have a kitchen. We have a vending machine here. We have one downstairs. We have 2 fridges. People can bring their. Why are we presenting almost like a bazaar style? Here we are, access. If one is, you need to ask them, you don't know whether or not you need to ask them. Because in some cases, when I'm passing through that station, that's after 5 p.m., the person who's in charge is not there. So I may not be able to ask anyone, right? Yeah. But it's there. Yeah. And in my mind, if I'm telling you today, this was a problem for me, that means it was a problem back then. Because every time, I need to go and eat something now, or I need to kind of fight myself. Yeah. So we took care of that problem. Good. And I'm glad we did, because there was this issue of are we just, getting into people's, personal space? It's not. It was a desk that didn't belong to them, but it's public. But it's also, there's maybe half of the people didn't like the situation. Now, nothing wrong. That person didn't mean to do any harm to anyone. Right. That's how we were kind of trained to please others. And we need that to change, because what you are describing is a huge problem. And I know a couple of my people who are really trying so hard, because every time we have our sessions, if it's not every time, every other, we talk about what they go through. And if I'm in their situation, this will be even more difficult. I think this is important for people to understand. Yeah. So, I don't have any ice cream at home. I don't keep them. If I take, Ethan, if I open anything, if I, let's say, take half of it, and my sisters used to get so upset when they see that, I would just trash the other half, so then I wouldn't eat, because I just needed that one, like, kind of encounter there, but I don't need the full amount. But if I keep it, then I know that I'm going to go back, because it's going to be readily available.
Yes.
So this is that simple.
Yeah. Yeah.
So, and this is nothing to do with just with patients after bariatric surgery.
No.
This is like, we are talking about our own issues.
Yeah.
So I really do advise people to kind of do a cleanup, especially if they are in a stationary situation. Make sure that they don't have immediate access to food. So, I mean, on Sundays, again, as you know, like, or Saturdays sometime, like, when I go and get some coffee with unnecessary calories, I walk 3 miles to get it. And I know that at least I will be able to offset that.
Yeah, spending some
But
energy.
not every time I'm able to do it.
Yeah, absolutely.
So that's that kind of like, let's put that out there so that people know why certain things happen in the office, because there's a clinical reason. So now, if we go to the for the long-term success, and how important the nutrition is, we know we have a different topic session episode for multivitamin use. What's the biggest mistakes, nutritional mistakes people are making these days?
Absolutely. So the biggest mistake would be really to fall back into the bad eating habits that they had before the surgery, right? And like anything, once you fall back into it, it's very difficult to get out. Again, it becomes a habit, right? Generally, what I find is people who really struggle with significant weight regain, that happens after there is a trigger event in their life that puts emotional or psychological stress on them. So typically, you would see a patient for years, Kemal, doing really well. We're talking about 5 years, 6 years, right? And then you would see them maybe at year 7 or 8, well, they will come and say, I have gained so much weight. Then I will know exactly that something happened in their life that took their focus away, right? Where food becomes something that they needed to reach.
Supplement, comfort.
Yeah, to comfort, right? To make up for the stresses and the emotional struggles that they're going. And this could be the loss of a loved one. It could be, getting divorced, losing a job. I just saw a patient actually the other day who did really very well for many years. She had a sleeve in 2015, and then in 2019, she lost her mom. And that was a devastating event for her, as it should be, right, in this situation. And then obviously it was very difficult for her to stay focused. And then the difficulty in this situation is, Kemal, is that the weight gain is insidious. In other words, people are not aware that the weight gain is happening because they're not focused on it, right? And then suddenly one day, and they may not be weighing themselves, and then suddenly one day they may find that, a shirt or a pair of pants may not fit, and they go to the scale, and then they're devastated because they now suddenly see that the weight had jumped significantly, right? And what they have been doing in that time is that they have fallen back to eating junk food, to eating too many sweets, perhaps drinking alcohol, drinking empty calories in terms of, juices and other things, right? So another thing which I see is that when that happens, patients tend to stay away from us because they feel guilty, they feel ashamed, almost they feel as if they have let us down and they don't want to come to see us.
They avoid us.
The tragic thing is that is the time when we want to see them. Yes, we like to see them when they're succeeding, when they're doing really well, and we're happy to see them. But it's far more important for us to see them when they're struggling, because that is when they need help. They need a perspective that is presented from the outside by us to let them know that really the road that they are in right now is not correct, and we need to change direction. That means we may need to help them find counseling if there are emotional issues. It is very important for us to provide tangible, practical guidelines about what tips types of food to choose, and to go back to the basics, which means getting counseling from nutrition, but also offering them ways for them to reset themselves, to get out of the routine they find themselves stuck by maybe doing the raw bar diet for 2 weeks, for instance. What I always suggest that to patients, that liver shrinking diet that you have coined essentially, it is good not necessarily because I want them to start losing weight in that method, but because it takes them out from the routine they are stuck, right? It offers them a fresh start.
Yeah, it's effortless. I do it.
Yeah, absolutely, absolutely.
Most of the weekdays, at least 4 out of 5.
Absolutely.
My lunch is a raw bar.
So,
like the intermittent fasting is broken by raw bars.
Absolutely.
It's not just one.
Absolutely. Absolutely. So that brings them back, but also it takes them out from this hopeless situation where they may find themselves because now they cannot lose weight anymore. Now, there is definitely more resistance by the body when you try to lose weight the second time, whatever method you had before. It is harder. So when they've regained weight and they are trying to lose weight, it is hard. That's why they need our help more than ever, essentially. But when they come, it's not just about us seeing them once. It's us really presenting them with a plan of action that would require us to get them to see a nutrition, maybe counseling. And then sometimes we may need to see if there are any anatomic issues also that are contributing to this. Now, people always ask me whether they've stretched their stomach, whether that's the culprit. That is rare. It can happen perhaps in gastric bypass, for instance, where the little stomach can stretch, or even the opening between the stomach and the intestine can stretch a little bit, but it's rarely seen with the gastric sleeve. With the gastric sleeve, you may have a stomach that becomes more compliant, but there is no way for the stomach to go back to the to the volumes it was before. In fact, patients know that. And the first thing I ask them, when they worry about whether the stomach has stretched, and I say, are you able to eat a full meal like you did before surgery? And they will say, no, I can't. I've never been able to do that since surgery. So I know that's not the issue. But there are instances in which we definitely want to check that. We want to do blood work as well to check to see where they are with their vitamins, with their nutrition. We want to make sure that with the increase in weight, they have not go back to the illnesses that they had, whether it's high blood pressure or, God forbid, diabetes as well. So that reassessment is necessary. And what it comes down to, Kemal, essentially, is really we have to look at obesity as a disease. We cannot see it as anything different than cancer or other illnesses, where these illnesses can recur and you need expert help to get you out from there, to guide you to come out from there. So yes, it is devastating when a patient finds themselves that they have gained weight, but it's not about judgment. It's about getting the right help. So they need to reach out to us so that the resources that we have available can be provided to them, for them to be able to start losing weight again. And things have not actually been any better than when we are right now, because now we can actually utilize powerful medication as well as an adjunct to what we've done to get them back to losing weight even more quickly than in the past.
Intermittent fasting.
Absolutely.
So we have episodes for these.
Yeah.
But I think we have to mention the physical activity. So building a sustainable routine, and that's after post-pandemic, everyone went through some adjustment period where we have issues with weight gain, regardless of morbid obesity or not. And then after that, finding what we used to do and how we used to do those things. It took some time for people to go back to that. But I think one part that we suffer the most is the physical activity.
Absolutely.
Like I remember playing tennis with a mask. And now I'm thinking it was so brutal. Like, why did they let us do that? I don't know. Why we played that? I don't know. But we did.
Yeah.
So we could have chosen that time, hey, I'm okay, I'll just opt out. We didn't do that.
Yep.
So Now, would I do it now or would I fight for playing without the mask? I don't know. So, but going back to the physical activity, from maintaining the muscles and the certain metabolic rate and having the strength, the muscle strength, these are all important, but yet the understanding of these is still kind of somewhat problematic. So, how soon they can start exercising after the surgery is one question, and also what type of activities would be the best for the post-surgery?
Yeah, absolutely. In terms of post-surgery physical activity, our answer is always immediately. Now, the type of activities they can do after surgery has to be staged, right? For instance, they are not able to lift heavy weights or do core abdominal muscle exercises for a month after surgery. But after that, they can certainly engage in any activity they want. In terms of what physical activity is good, Kemal, I think a combination of aerobic exercise and resistance training is really the best, right? You want to do that aerobic exercise to make sure that you are metabolically active also, because it's the best for cardiovascular health, right? It's also good for their psychological well-being when you're really working out on a regular basis, aerobically. But building a good muscle mass and protecting that muscle mass is also very important. Muscle mass is a very important component of our metabolic activity. In fact, the muscle is much more active than fat metabolically. So if you activate your muscle, actually you tend to burn more calorie. And then if your muscle mass is active, your basal metabolic rate is going to be higher, which means you're spending more energy, which means you're more likely to lose weight. You're more likely to stay at a lower weight if your muscle mass is also active. So doing resistance training and also aerobic exercise is very important. That combination is important. But in general, Kamal, the key advice is we want them to be moving. We want them to be moving, right? Now, the way you and I are interacting right now, we are sitting down, Kamal. We are sitting, we're moving some muscles, but barely some. I'm moving my hands, my fingers, maybe my facial muscles, my neck I'm moving, but the rest, the bulk of my body's skeletal muscle is sedentary right now, okay? And a good amount of our 24-hour day is also spent in that situation because we sleep. When we sleep, we're not moving at all. So it is critically important that we devote a good amount of our waking hours to movement, right? We talked about earlier on about people's jobs where they may be tied up in a chair looking at a computer. Well, they have to find ways for them to have movement, which may just mean just getting up and maybe walk for a few minutes around their hallway or in their office, or at the very least, utilize their breaks to go and move rather than sit down. Right. That is also very important. Now, one way to improve on that is to track how much movement people do. Right? The vast majority of people now own there you are, the smartphone or a smartwatch. And I generally think that if people could aim, there you are, absolutely.
Look, this is,
yeah,
so important.
Yes,
and critically. I know I have mentioned this so many times. I check this every day.
Yeah,
I have to.
Yeah,
I have to see where I am.
Yeah.
Now the other thing that I have to do is I have to see where I was last month and where I was last year. So when you look at here, now I'll explain why I'm lower than last year. So I didn't have an iWatch last year.
Yeah.
I think I got it. I don't know. John Donald probably would know where I got it, but I didn't have it in the beginning of the year. So when I was playing tennis, I was giving myself more credit for the steps. So let's just kind of confession number 2 for today. So what used to happen was, and that's kind of like Alp's fault too, because I checked it with him and he's like, yeah, it sounds right. So I used to give myself 5,000 steps when I play tennis. But
I think that's just about right, though,
well,
right?
no, I watch disagrees with you. It gives you only 3,000.
Oh, really? Okay.
So last year when I manually entered that,
Yeah.
it probably did increase that number.
Yeah.
But that's kind of like just like the joke side of it. So when I know that I'm about same,
Yeah.
and last year, and I made a big change in what I'm doing. So it was a good year for me. There was a big increase from year before.
Yep.
And then now I'm trying to maintain that, but I don't want to be lower. Even though this number is slightly inflated, I still want to exceed that number with our organic efforts.
Absolutely.
So this requires one motivation, but
And
that
tracking.
is monitoring.
Yes.
Monitoring and
tracking.
it's almost equal, at least for me.
Yeah, absolutely.
So like I'm kind of like with the numbers, I'm competitive, so I need to beat. How also clinically from our ACO, we have to be better than our own numbers from last year.
Definitely.
Same logic here. I have to be
We
better
like
than
that.
year before, right?
Yeah.
So, but without this, it doesn't happen. So when I see myself at 3,000, I know it was a bad day.
Yeah.
And then I try to offset that with other activities, other days. In the same week, we try to get that number up. So, there is no way they can actually maintain certain outcomes unless they are measuring.
Absolutely. That's the key. And so, really, when it comes to physical activity, the foundation for that is movement. In other words, there has to be enough steps that person is walking on a daily basis, just doing their own chores, right? But as you correctly said, if you monitor it, then you will know where you are, and that will be a basis for you to make changes for the next day. And those changes could be, okay, well, from now on, I am going to take the stairs instead of the elevator. I am going to park my car further away, if it's safe, rather than closer to the door. When I am going to the store, I am not going to look for the shortcut. I am going to look for the longest route.
Right.
If I'm going to the mall, I'm not going to park near the store where I want to go. I'm going to park in the opposite side, so I will have to walk all the way to get to that place. When we do that,
or if it rains, instead of not walking outside, go to the mall,
and walk. When we do those things, not only we are adding steps to our day, which means we are adding movement, but also we are decreasing the times in which we are spending sedentary. So the trade-off is big. Not only we are adding movement, but also at the same time we are decreasing the sedentary time, because we cannot do both at the same time. We cannot be sitting and walking at the same time. We can do only one. And so if we are choosing to walk, it means not only we're being active, but we are being less sedentary, which is just as important. So that foundation is very important. So what I tell patients is, as soon as they get a smartwatch or they decide to follow their steps on their smartphone, I say, track it from the minute you get out from bed to the minute in which you're going back to bed. How much walking did I do? Now, ideally, what I recommend people do is they try to get 7,000 steps a day, right? That number, I think, is a good number, Kemal. But it may be far off for many people, and that's okay. We don't expect them to get there overnight. We want them to aim for that.
Let's put that in perspective. So when I try to hit 10,000 steps, and when I'm home, I don't sit down. So in the office, I try to come to the kitchen a lot. In the old office, surprisingly, I didn't do that, but here I do it. But when I take 2 walks, one long, one short, with Joshua, it's actually hitting the 9,000 is sometimes challenging. So I have to try extra hard to do it. So now I'm about 220, 224 maybe. So playing tennis on a weekly basis, pretty active. If we are talking about someone who's coming down from 390, we don't expect that person to walk 7,000 steps.
Right. Yeah.
So 7,000 may be the goal.
Yes.
But they need to get up, start with 4,000,
Oh, absolutely.
4,500,
Absolutely.
5,000.
Absolutely.
But 7 is a comfortable number because
Yes.
I know what it takes for me to do that,
Yes.
to get to the 9,000, 10,000. But we are not expecting that from day one because of
Absolutely
the
not.
level that they were at physically,
Yes.
and now how they're going to actually improve from there.
Yeah.
It's going to be a gradual improvement. So that's important for them to understand. And also having some goals.
It's good.
You know, like if you kind of like certain spots that you want to walk to that and then come back from there, knowing where you're going to go and come back, then you are able to kind of calculate how much you are walking.
Absolutely.
Usually if I'm just walking without the actual midpoint, I don't know if I walked enough. Sometimes I get either it becomes too easy or too difficult to come back. I did that last Sunday. We took a different route and it was a little bit longer than my normal one.
Yeah.
So, but it's all there, and all the resources are there.
Absolutely.
So
Absolutely.
we are here.
Yep.
We are here to help everyone who is willing to follow our surgeons and our nutritionists, our primary cares, clinical recommendations. Dr. Ergau, thank you again for joining us
my
today.
Pleasure.
We have to keep in mind that bariatric surgery is just the beginning of this new journey. We need to make sure that we understand how this is going to change the future for us, for our patients. Because of that, daily commitment is extremely important.
Yep.
And then staying in certain discipline is going to be the key.
Yep.
Stay focused, stay supported, and always make sure that you follow us on Fridays and stay united. Thank you.